Good afternoon, everybody. Welcome to the session on public-private partnerships. My name is Carl Brown. I'm Associate Director of Applied Technology at the Rockefeller Foundation, and I'm the focal point for eHealth, which is part of our portfolio in health systems. I'm going to be moderating this panel, and I'm just going to say a few opening remarks, and then I'm going to pass it on to the presenters. My personal background is in computer science and in enterprise software, and I started working in the global health space in about 2007, and as many of you know, this is a very strange space, so I've been learning a lot. The Rockefeller Foundation has been involved in many PPPs over the years, a lot of them starting in the late 90s, with a number of disease-focused PPPs and PDPs, which are product development partnerships, like IAVI, the International AIDS Vaccine Initiative, and the Pediatric Dengue Vaccine Initiative. There were many experiences and lessons learned during those large-scale PPPs that brought together big donors, big multilaterals, and big pharmas to develop new products for neglected diseases. And my old boss at the Rockefeller Foundation, Ariel Pablos Mendez, he was involved in setting up a number of these, and so I learned a lot from him and the experiences that he had during those years. And for those of you who are interested in reading more about a really good failure case of PPPs, I really highly recommend a book. It was one of the first books I read when I arrived. It's called The Politics of International Health by William Maraskin, and it's about the Children's Vaccine Initiative, which was this wonderful idea that didn't work. And it's all about what happened in the setup of that partnership and why it ended up not working. So I highly recommend that book. So now we're in a new era of PPPs focused in the technology space, and we're going to hear about a number of those today. The Rockefeller Foundation itself, we're one of the founders of the mHealth Alliance, along with the UN Foundation and the Vodafone. And I think one of the advantages we have in the technology space is that technology companies are not really seen as the boogeyman, as some of the pharmas were by the public health community. So there's a bit more of an opportunity and space there for collaboration. And we also have an important new set of actors, which are the mobile network operators, who have together sort of achieved massive scale of one of the most transformative technologies. So our discussion today is going to be focused on both successes and failures of PPPs and lessons learned. And I just wanted to start out with a few sort of high-level points that I've sort of garnered from my reading and from my experience. So first of all, I think PPPs are very hard, and they sometimes fail, and that's okay. But these are risky ventures, and I think it's just as important to learn from those failures as to never try, because they're not all guaranteed to work. Secondly, PPPs can leverage extraordinary value. They can do a lot more together that could never be done by the actors individually. The alignment of goals is crucial. Everyone needs to have the same sort of North Star in a PPP for success to come about. Shared and co-ownership is important. People need to be heard, and so if there's one dominant partner in a PPP, that usually ends up not working. And finally, I think this is just many personal experiences, that PPPs are not just about relationships between institutions. They're also relationships between people. So personal interaction matters, personality matters in these PPPs, and the people that are at the table, how they relate to each other has a big impact on the success or none of the failure of the initiative. So we're going to do two things here. We're going to do some quick presentations from the four panelists, and then we're going to move into a fishbowl format. And has anybody ever done a fishbowl here? Raise your hand if you're familiar with fishbowl. Okay, so a couple people have. So basically the fishbowl it's a space for all of you to join the conversation. So it's not a Q&A session. It's actually, if you have something to say, you come up and you sit in one of the empty chairs, and then the microphone will come to you, and you can share your own experiences, ask questions, give comments, whatever you like. And we really want as many people to participate as possible. When you're done talking, you can then go sit down. And the panelists may stay or they may sit down, depending on if they have something to say. So we want to kind of have a flow of many voices here, because I'm sure there's a lot of experience about PPPs in this room. Like, how many people here in this room have been involved in PPPs of one sort or another? Wow, okay. So hopefully 90% of those people will come up and also share their stories. We'll see if we can get to it. So I want to move to the presentations now. So the first presentation is Jill Fortune-Abrahams. She's Director of Telemedicine and mHealth at the Medical Research Council of South Africa, and she'll be talking about a project that they did in South Africa. Jill, welcome.
Thank you very much. Hi, good day. My name is Jill. I'm from the Medical Research Council, and I'm going to tell you a bit about our MTN SA Foundation project, which is a public-private partnership between MTN SA Foundation, the Department of Health, and the South African citizens. I'm not going to, because we're keeping our presentations quite short today so that we can engage with you, I'm going to be skipping over 1 or 2 slides. So just to tell you a bit about the project and get stuck into it. So MTN SA Foundation is a CSI of a large mobile operator in South Africa, but also one of the largest mobile operator in Africa. They have a slogan, the CSI, connecting communities for sustainability in terms of education, health, arts and culture, and entrepreneurship. So basically they create connectivity for community to empower children, and thereby also trying to further their entrepreneurship, because we have a 40% unemployment rate in South Africa. And then also arts and culture. And underlying to all of that, they ensure that there is healthcare. And through the healthcare, they started the initiative with us in terms of rolling out telemedicine workstations throughout the country. So basically what a telemedicine workstation is, it's just a computer with cloud-based software that allows the nurses, the health professionals at the health facility to interact with specialists at a remote site. It started off in 2008 with only 4 telemedicine workstations, and has progressed over the years, and as we stand today, there's 76 workstations implemented across South Africa in 7 provinces. We have trained over 550 health professionals throughout the country. The training course has been incentivized in terms of keeping it CPD accredited. We have a support desk available between 8 and 5 every day, 5 days a week, and retraining is available at request. Just to say, 553 health professionals is not even the tip of the iceberg in South Africa. 76 workstations is not at the tip of the amount of health facilities that we have in the country. We have over 4,000 health facilities in South Africa. I think more importantly, what I'd like to talk about is the model that we used. The model that we used was basically, as the MRC, we were responsible for managing the entire partnership between the Department of Health, that's the provincial departments of health, and I want to emphasize provincial departments of health and not our national Department of Health. It started out with developing, engaging with the departments of health, developing a memorandum of understanding, and the health department was only responsible for supplying the health professionals. MTN Foundation came on board with about 8 million rands, which is more or less equivalent to approximately $1 million US, when the rand was a bit weaker to the US dollar. They were responsible for the business strategy. It was a corporate social investment and taking skills to community level and using an integrated approach. So it wasn't just focused on healthcare. Healthcare was only one component. And the benefactors was the South Africans in terms of their access to specialists, better healthcare services, and improved health outcomes as well as cost saving. So I know yesterday in one of the sessions where it was about evidence, we were discouraged from engaging with CSIs because they couldn't sustain it. And I think that is true in many respects. But in terms of MTN Foundation, they have been involved in the project for 4 years. And they've used the approach that $1 spent is $1 saved, and that's the approach of Professor Kwankam from ISFTEH. So in terms of the successes, we found that there's definitely a health system strengthening. However, the evidence would be something that we are still going to prove, and an independent company is doing research to do that. There was provincial government participation, and we done this through having stakeholder sessions, as I mentioned, and followed up with those that were committed with an MOU. There was definitely increase in availability of broadband in most of the rural areas in South Africa. 65% of South Africa is based in rural areas, and we found that there was still no broadband connectivity. So basically what our team done was they gave the GPS coordinates of those sites that didn't have broadband coverage, sent it to MTN Foundation, and they then improved the coverage. By doing so, it also spilled over to education, arts and culture, and entrepreneurship. So the challenges. So today, the challenges are a very sore point in South Africa, but it must be stated so that we can further this initiative. I'd like to apologize in advance if I offend anybody, because I know this is being streamed in the audience. So firstly, let's start with regulation. In 2009, a moratorium was placed on all ICTs in health in South Africa, based on the fact that too much money was being spent on ICTs, that they were not interoperable, no policies or standards existed. In 2012, e-health strategy was launched in South Africa. So it took about 10 years for us to develop an e-health strategy and adopted. But as yet, the moratorium has not been lifted, nor has projects like Hello Doctor been allowed to continue with the project. Despite attempts to get it going, it still has been stagnating. And this trickles over to the lack of awareness. If there's no regulation, we can't make people aware, we can't inform people what's happening. In terms of the national government commitment and leadership, the South African government started off with a huge bang last year. We had this very hoo-ha meeting in April last year, 2011, and they seem to be making some inroads, but this has clearly fizzled out and left many people disillusioned and frustrated. So how can we expect adoption? This is not indicative to health in South Africa, but to all sectors of government. I leave South Africans in the audience, if there are any, with 3 words: Nkandla, Limpopo, and textbooks. Health professionals have as yet not embraced ICTs for health, mobile health in South Africa. There's still no engagement with health professionals, no South African scientific publications, no short courses, no health professional council policies about practices, not even a dedicated person in a department of health that is responsible for e-health in South Africa. That is how bad it is. So what is our solutions? We're looking at leadership driven by independent persons, because clearly it's not working in government, but we cannot leave government out of the loop. We need to engage with them. And we appeal to Mobile Health Alliance or anybody who's willing to come on board and set up such an initiative to integrate the M, the E, and the tele into the health system, and no longer talk about mobile health, e-health, telehealth, but just talk about health systems based on an ICT platform, to nurture champions and engage with champions, and to ensure that there's knowledge sharing and collaboration. I'd like to thank MTN SA Foundation for sponsoring my participation in this event, Mobile Health Alliance for the opportunity to present, and the telemedicine and mHealth team at the MRC. Thank you very much.
Thank you, Jill. And I have a lot of questions to ask you afterwards, so we'll get to them in the fishbowl, I hope. Thanks for the great presentation. Next is Alice Fabiano, who's a Senior Program Officer at Johnson & Johnson, and she's going to talk to us about the MAMA partnership and hopefully others.
Good afternoon, everyone. My name is Alice Lynn Fabiano from Johnson & Johnson. I'm very excited to be here with everyone today and this afternoon for this really great discussion and this really important discussion on public-private partnerships. As a way of opening, what I'd love to do for this brief introduction is to provide a private sector perspective on private-public partnerships, and specifically how we can really accelerate the work in the context of improving the lives of women and children. There we go. I just wanted to take a little bit of a step back first and talk a little bit about the context of where we are today. And as Carl has opened up this presentation, and we see the number of people in this room who have had experience really working in public-private partnerships, we realize that it is hard, but we realize not only should we do it, but we need to do it. And part of this is the context and external forces that are around us today. One is around the rising care of healthcare costs and the shortages that we know, the 4.5 million healthcare workers in Africa and Asia. That is a huge shortage of where we need today to deliver healthcare to women and children that need it the most. The second part of this is that we are lagging in our maternal and child and MDG 4 and 5 goals. We've made great strides together over the past years, but we are behind in how we will reach our targets by 2015, and we need to work together, innovate together, and accelerate in order to reach these goals. And finally, in the midst of all of this, there is a global recession that has happened since 2007 in the financial crisis, and it's really strapped us both financially and from a time perspective. And because we do need to do things more, and we need to do things faster, and we need to do things with less, these are all the reasons why it is really important to work together and to really keep in mind what we are doing to improve the lives of women and children. In the midst of all this, it's important to share that the most vulnerable and the most pressing parts of this are affected. And day to day, the question that we really need to ask ourselves as we are slogging through public-private partnerships is, how are we going to help the 800 mothers who are dying a day of preventable pregnancy-related diseases? And so one thing I'd like to offer up is that public-private partnerships is a very innovative way to addressing society's most pressing issues. We know maternal and child health is an incredibly complex issue. We know mobile technology and mHealth, by definition, is not something that we can achieve in of itself. So how do we really work together to bring together the innovative technologies that are in this room with the innovative delivery processes that are here? And at Johnson & Johnson, we've had a really great legacy and history of working together in partnerships. For over 125 years, we've worked with various organizations across the world to make life-changing differences in human health. What I'd like to say today is a little bit about our work in mHealth, and I'd like to start with a partnership from the first mHealth Summit called Text for Baby, which is an idea at the time between a partnership with Healthy Mothers, Healthy Babies, Voxiva, the White House, and many, many other partners. Since then, they've reached their second-year birthday. We're at our third mHealth Summit, and that partnership has grown to hundreds of organizations across public-private sectors to really make that program work. And we're really happy, and we salute all the partners in that program. Since then, last year, we also launched the Mobile Alliance for Maternal Action, and that was a partner with USAID, the United Nations Foundation, mHealth Alliance, and Baby Center, a Johnson & Johnson family company. And that partnership has been tremendous in its own right in reaching those furthest and in most need across the world in Bangladesh, India, and South Africa, and engaging a global community and doing this work together through adaptable messages and scaling those services across the world. What I'll say about these two partnerships and the many more that we've done is that partnerships are hard, but the rewards are incredibly great. And if anything I leave you with today, it's that not only should we continue to do this work, but we should double down on doing partnerships together. You know, I throw up the slide a bit on how, and this is to Carl's question of, you know, what are the things and ingredients really needed for public-private partnerships? And I'm going to start with the picture on your right-hand side, which is this long and windy path. And it is the one in which I think we all know that we're going to walk down together as we enter public-private partnerships. What I'll say today is we know that's a dark and windy path. We also know it is a windy path that will change directions in a completely different way than you expect to in the beginning. And that's okay, but that's something in which is important for us to realize in the co-creation process. The second part of this is really taking a leap of faith, and I'm throwing out kind of an example on the left here, which is rather odd, but it's an example of a gorilla and a bunny named Samantha and Panda. Are folks familiar with this relationship? Have folks in the room heard of Samantha and Panda before? Okay. So this may be a personal exciting piece for me, but I see this story as one that is one of huge human interest, animal interest, one we can learn a lot about. It's a story of a gorilla. It's named Samantha, and it is a story of a Dutch panda, and the two of them are now kind of life partners together, and they have this symbiotic relationship, literally together, working their way through life. And the reason why I think this works and the reason what we can learn from this relationship is that it is a really different one than what we would think would work. It's an old gorilla, it's a young bunny, it's a big animal, it's a small animal. In the room here, you may feel like you're a gorilla or you're a bunny in these relationships. But at the end, how this works is that both need each other, no matter what shape and form they come in, and is one thing which public-private partnerships should continue to think about and differentiate as we continue moving forward. And I'll leave you with more of a concrete example of Mama and how, and a couple of nibbles along the Adaptable message path that we've taken. Last year at the summit, we launched Adaptable Messages. It's free messages on the mHealth Alliance hub site in which you can download and adapt to your country to deliver mobile messages to mothers. Since then, the messages have been tapped by over 100 organizations that are delivering this type of service across the world. What we've learned from this and how we've worked through this, I think, is a really important lesson I wanted to share with folks here, and I'll leave it with kind of 4 different parts. The first one is to really nurture your fragile partnerships. Partnerships in itself are folks coming together in a way in which they never have done before. And they are fragile in the beginning. And you really do need to, as Carl said, it's people. And people need to be nurtured, and partnerships need to be nurtured. So invest the time, invest heavily, and take a leap of faith in there. The second piece of it is to develop a backbone. And I mean specifically in a staff. One thing in which Mama had in the beginning was really strong partners who all were very dedicated to our common goal of reaching moms across the world. What we have started to develop, and this year is the first year kind of anniversary of our partnership director on board, is a global staff who will really be the owners of stewarding the mission of Mama going forward. That allows the partners to really dedicate their time to what they need to, and it really allows a certain level of coordination that's very different in partnership that requires that investment in the staff and a backbone. The third part I'm going to talk about is what happens when there is a disagreement, because there will be many, many disagreements along the way, and how to work through that. What I will say is something that I believe in strongly is there is room for input. People have to be heard. There's also a point when you enter the spiral of what I'll call kind of death by discussion. And everyone's reached that point at some point. And what I will say there is what needs to happen is an agreement of how to move forward, because we don't want to be paralyzed within the work that we need to do, and there's too much good work to stay in that way. And the last point that I'll leave you with is to really stay true to your moral compass, and to stay stewards of the women and children that we serve, and to really realize the reason why we were all brought together. In the case for Mama, it was to deliver mobile health messages and improve the lives of mothers across the world. And I hope that we'll continue to do that, and I look forward to the discussion in the fishbowl and hearing more about public-private partnerships across this table. Thank you.
Thank you. Thank you, Alice. So is Johnson & Johnson the bunny or the gorilla? Everybody wants to know. So the next presenter is Kailik Pho, who's program manager for mHealth at the GSMA based in Singapore. And he's going to tell us hopefully about what the mobile operators want and what they don't want. Maybe more.
Right. Thank you, Alice, for that talk. I'm just wondering who the gorilla is, or whether or not there are actually 2 gorillas when you're talking about health and mobile. So we're starting this conversation about building bridges between 2 very, very different industries. And the result of this, it came from a request from the WHO to us to perhaps prepare an engagement guide between network operators and health, because I think they acknowledged that there are different languages being used, different expectations, metrics, and they thought it would be helpful for us to have a conversation on the topic. And what we did was we went out and spoke to a number of our operators as well as health parties that we've worked with, and got the feedback back, and then presented the information back from the operator's perspective so that there could be better communication and understanding between both parties. So first part of it would be some exciting feedback from the ground. So these are actual quotes. So we're trying to be as direct and as transparent about the feedback as possible. So how does the global health community actually view the mobile operator community? So just hands up, who's actually worked with a mobile operator before here? Who's actually engaged and negotiated with them? Great, excellent. So some of this may resonate. Just interested in commercial results and big press releases. Lots of nods. Okay, good. Difficult to navigate, very big bureaucratic organizations. Slow to respond, but once they respond, they expect instant turnaround. For the worst one, which is assume that the health community does not understand the business realities under which the telcos operate. But and this is one of my favorite phrases to characterize us. They see us as a necessary evil, which is good, to ongoing sustainability, at least it's necessary. As connectivity, no matter what you say, it represents an unavoidable majority of the cost structure of mHealth. And secondly, on a slightly more positive note, it is a major private sector partner with the resources to help the government take over. In many cases, I think governments by themselves would not perhaps have the resources to hold the service after it's been handed over. So I think they see the telco sector as a major private sector to help that happen. Let's flip the picture, look at it from the other side. High risk, and when I say high risk, it just means that they're not familiar with the health sector to begin with, and as such, the revenue models and the returns and the business models are unfamiliar to them, so it's very difficult investment to make for them. Secondly, it's organized for innovation, so a lot of great ideas, but not necessarily for scale. And third is, I don't know how many of you agree with this, it mostly needs the mobile industry just for minutes and text, and in particular, free minutes and text. So, from a business model perspective, not thrilling from there. But some good points. They do need the innovation, which is good. They do recognize that it is the community closest to understanding government public health needs, and particularly most committed to delivering health impact to the end user. And, shall we say, maybe accompanied with funding from the donor community, which is, again, always good to have. So I think there's some bits where there's a little bit of a disconnect, but there is at least recognition of each other's value, which is good. So I think the first point that I wanted to make is they are two different industries, so we do need to acknowledge the differences and move on and just understand that we come from different places. And also understand why it is, some of the reasons behind some of these differences. I mean, it's a very different product that they're familiar with. Mobile is familiar with a large, affordable, large target population out of pocket. It's simple to operate with little or no training, simple to deploy, and it's usable for multiple sectors with little or no customization. Now, what is health familiar with? Varies greatly, it's free, it's paid for governments, there's a variety of different things that could be going on. It's relatively complex to operate, and often there's training, certification, regulation, and particularly at this point, it's difficult to deploy, expensive to support, and it just takes on a lot more cost than a typical model where they can take a single product and roll it out at scale very quickly. And the last but certainly not least is that while core functionality itself might be standard, there's usually a lot of customization that's needed to make it relevant to particular diseases, geographies, and even for particular people. So it's a very different world in terms of what they're familiar with. Secondly is difference in definitions of scale and sustainability, and basically the metrics of success. So scale means, from a health perspective, reaching more people, percentage of the target population, and degree of measured health impact. Sustainability is some concept of where the government takes over, the private sector takes over, or there is some grant funding. For telcos, on the other hand, what it means for them, scale is subscribers, geographical coverage, replication, and most importantly, increase the uptake in their core assets. And sustainability for them just means that the health services itself generates more revenue than what they could have done with those resources in some other sector. So that, again, differences in success metrics. So really what we've advocated is really to try and find a joint value proposition in all of this. And one is to first be very clear about what you're actually looking for from the telco operator. Now, in most cases, I have alluded to this before, most would just need the telcos for network assets, talk time, text, data, and so on. But I think what I wanted to demonstrate with this slide is that there's a whole slew of different assets that you could negotiate with the telcos with to create a true partnership, either as a service provider or as a partner, where you can leverage the full range of telecom assets, ranging from billing to marketing, distribution, as well as perhaps even equity investment. The other piece to note is that there's, while we like to say that the operators are the only people there are often many other people in the ecosystem. So there are aggregators, wireless application service providers, and, dare I say it, over-the-top players like Google and Facebook. So if you're not getting what you need from one party, I think one of the feedback that we got from the public health community is that they've often gone to other parties who can perhaps offer the same connectivity, but at a business model that matches what they're looking for. And on the other side, what is the value proposition from global health perspective? First thing, and this is maybe an across-the-board assumption, but it is standalone direct-to-consumer type use cases is kind of limited from a telco's perspective. The impact on revenue for consumer apps is limited. It's admittedly limited. The effect on loyalty and brand that people talk about is also not really perceived by the telcos as being particularly significant. So that this is a problem if that's what's going on here. So the conversation that is of more interest to telcos is really packaging for scale, and particularly when you're talking about health systems. Because at the health system level, you can talk about real uptake of core telco assets. And not only that, you can talk about different health offerings. So I think part of the reason for this fragmentation as well is that, as a single service providers, the value proposition is not kind of concrete in itself, but as a package, it creates a more compelling value proposition that they'll find more interesting. And the third level is actually to package health itself as part of a broader government enterprise services. In a lot of telcos, health is actually not a standalone unit. It's actually together with a kind of an e-government, government enterprises business unit, and they see health as one sector out of many that they can offer as a larger value proposition to government. So third is some practical points about navigating the operator organization and processes. First thing to note is that, like I said, I think telcos are extraordinarily large and complex organizations. And one of the things to note is that there are different groups. There are people that operate at the group level. And for those people, their role is really to recommend the product or the service to their country organizations. But the country organizations are also important because they approve these projects, because they hold the profit and loss of the organization. And in addition to that are all the people that sit behind the scenes that have the ability to veto these projects. So I think the important thing to note is that each one of these have very, very different metrics. So you can tell about somebody who sits at a business development layer who will have a strong, longer-term strategic vision, but somebody who is at the country level is measured on revenue at a quarterly basis, and if they don't make the quarter, their careers are at risk. So I think it's important to know what those metrics are. I won't go through that. I think that's too busy a slide, but I think the real message there is that there are different ways of engaging, ranging from being a corporate social responsibility type project to a commercial project. But more and more, each one of them do have their own metrics, depending on the size of investment that you're looking for. But CSR plays, by and large, across the board, are getting now harder to go for and manage, because I think the perception is that to do CSR and to do commercial takes up the same amount of organizational time. So if the return for one is very small and one is very large, then they would not prioritize this as important as perhaps a commercial project. So that's just the other point. And last but not least is reading between the lines. And I think I'll just pick a few things from here. This is a typical kind of an operator evaluation template that is given to new projects for being evaluated. And one thing I want to say is like a health need, for example. What they mean by that is actually, is this health need important that someone's actually willing to pay for it? That's one. It's target market. What that actually means is the target big enough or strategic enough to their plans. Access channel translations, will it actually use their core assets in a way that's commercial? And technology platform, the real question that they're asking is whether or not the platform that they're using can be reused in multiple ways in different geographies and so on. So these are just some of the things that we've found, and what we'll be doing is collecting this information and publishing it through the WHO, try and see whether or not we can improve the amount of information in the room so that there's perhaps less misunderstanding about what each other is trying to achieve. Thank you.
Thanks, Kylie. So our last presenter is Michael McKay, who's a technology specialist with RTI, and he's going to be talking about a project in the Philippines.
Hi there. My name is Mike McKay. I've worked in eHealth and mHealth in a lot of places all over the world, in Africa and Asia. Today I'm going to focus on a project in the Philippines. I'm going to give you a little overview about what the project there is. Little overview, and really I want to focus more of our time on the partnerships aspect of it. But honestly, I'm most excited about getting into the fishbowl with all of you. I've been following Judy and Susanna's tweets. I don't know who you are, Judy and Susanna, but I'm following it. There's Judy in the back. So I know that everyone out there is excited to join in the discussion. So hopefully we can get to that quickly. So Wireless Access for Health is a project in the Philippines. We generally refer to it as WAH, W-A-H. Really what it is a electronic medical record that's providing point-of-care service in rural health clinics in the Philippines. We then take the results, aggregate them, and send them over the 3G wireless network up the reporting chain to the provincial government or to the national government. There's other aspects of it, but so far we're doing about 1,600 patients per day through this EMR. And there's 30 different health units. Basically all the health units in the province of Tarlac, which is our focus area, all have the system implemented and up and running. Some other things beyond the EMR that we've implemented for this project include a SMS patient reminder tool. So this will send reminders to patients that they need to come in for a visit or that there's an opportunity to have immunizations. We call the system SPASMS, spasms. So the WAH project has spasms component, right? It's kind of weird. There's other aspects of the project. We have tools that are delivered over smartphones, tablets, netbooks that are used by mobile midwives when they're out delivering services beyond the health clinics. So really, we've got a bunch of buzzwords. All the mHealth, eHealth buzzwords that you could think of are in this project. But if you want to talk more buzzwords, you can head down to the exhibition floor, and people will love to buzzword bingo with you down there. So instead, what I really want to talk about is partnerships. I think that's interesting. I mean, my co-panelists have done a great job talking about their experiences with partnerships. So what I want to do is just give you our experience from this project specifically. So here's the partners. You've got to do one of these slides that kind of shows everybody so everybody feels like, okay, they were represented in the slide. But actually, that's not why I put this up. I put this up because each one of these partners is really, really critical to this project. And I just want to slice and dice them a little bit. I'm going to take it off the screen and just get you to think about these different partners from a couple of different ways. So you can slice them international, national, local, right? So we've got international, we've got Qualcomm Wireless Reach Initiative. They were the initial and main funder. We've got USAID, Philippines. We've got RTI International, my employer. That's kind of the international perspective. From a national perspective, we've got the Department of Health, the University of Philippines, Smart Telecommunications. This is one of the mobile network operators. And more recently, we've got the Zulig Family Foundation. So this is a new donor that's come on board. When you look locally, we've got the Tarlac province. This is kind of like the state government. We've got the Tarlac Provincial Health Office. We've got the Tarlac State University. And then we've got actually the municipalities. The mayors themselves are very much stakeholders in this project. So that's kind of international, national, local perspective on this. Another way you could slice and dice our stakeholder list would be, public and private, right? I think that's the name of this session. You could also divide them into technology, healthcare, government, or how about donors versus implementers. I think it's good to think about those different categories and where the stakeholders in your project fit into, because really each stakeholder, each partner brings some level of unique expertise to the project. Every stakeholder has a different reason for wanting that project to succeed. And it's really, really important to understand what are those motivations. Because what we aim to do then is to combine the strategic advantages that each one of those stakeholders brings and kind of unite that broad diversity, that international perspective, those mayors that know exactly what their constituents want. We want to unite them behind one shared goal. And I think it's when we do that, that's when the partnership can achieve so much more than if just you were a single NGO or you were, doing your work at the Department of Health or the Ministry of Health. So I just want to talk more about one of the partners, Qualcomm Wireless Reach. I mentioned that they were the initial funder for this project. Their reason for wanting to get involved, they say that they want to bring wireless technology to underserved communities, right? But they're the first to tell you that they also have a very strategic business reason for doing these projects. In the Philippines, Qualcomm wanted to help expand the 3G network beyond the urban areas, get it out into more of the rural areas. 3G technology is their intellectual property, right? They also wanted to strengthen relationships with some of the local mobile network operators. So they had some real clear strategic objectives to do this project. And I think as the project has continued to expand over the last 4 years, those things have happened. And the project, not just Qualcomm, but the project itself has benefited far beyond just the funding that Qualcomm provided, right? It turns out that Qualcomm is amazing at doing event launches. So after we did the pilot and we got it all working, we wanted to launch it and basically announce what we had achieved. Qualcomm brought world-class PR and a world-class event to the middle of nowhere in the Philippines. One of our big challenges was how do we land the helicopter with the Qualcomm executive out in this area in the Philippines so that we can have this really gigantic event. And that's kind of weird, like a big PR campaign for an mHealth project, right? But as a result, this project's profile just went through the roof. And that brought on new additional stakeholders who saw the TV specials about the project that we were working on, and it brought more funding. And as a result, there's been a massive demand to scale up this project beyond the initial target zone. So I think that's just one of the stakeholders. That's Qualcomm. I could tell you stories about, Tarlac State University, what they brought, or any of the other stakeholders. But things aren't always easy. Simply choosing the name Wireless Access for Health may have been more difficult than actually implementing the technology, right? Getting those names right, getting everyone to agree on what we're going to call ourselves, that's tough. Cultural differences are hard too. Whether you're talking east-west or corporate, nonprofit, that's tough. But you need to find ways to work past those differences. One of the solutions that we found in the Philippines was, can you guess? Any guesses? Karaoke, right? You go out for karaoke afterwards and you build, like Carl was talking about, those personal relationships that really help you to understand one another, trust one another, and then push forward with your projects. So, really, I believe that when you're talking about a partnership and when a partnership is done well, the whole is really greater than the sum of the parts. That's what we're aiming for with the partnership, and that's what I encourage you to look for in all of yours. So, thank you.
Okay, now's the time when it's your job to help us continue this discussion. So we're going to move down here, and there's going to be, I think, 2 empty seats, and we'll start the discussion as soon as those seats are filled. So we need 2 volunteers to start. And I have a few questions that I'll just throw out there, but you can also make some comments. So one is to follow up with what Mike was just saying. How do we align the differing goals between private and public sector players and between those other divisions you're talking about in terms of health technology, local, global, international, national, and so on? And then another question is, can gorillas and bunnies actually be equal partners? So, and if you're new to the fishbowl, just introduce your name and rank and serial number, and then go ahead and make a comment. So, anybody want to take any of those, or make a comment? That's fine.
I can just respond to how do we align on the goals. Actually, Gordon, my boss, is here, so he might be a good person to do this, because we were together in the Philippines, going to meeting after meeting after meeting with all of these different stakeholders and just trying to understand where are people coming from, what do they want to achieve with this project. And then you it's kind of like setting up a blind date. You get 2 people together and you give them some things to talk about and hope that the conversation goes in the right direction. And slowly you just piece that together. But it's much more of a social challenge than anything else. It's like social engineering. I would say, of trying to figure out what those goals are and get people to work together.
Gordon Cressman, RTI, so I can respond to that too. That, of course, the easiest way to find out what an organization's objective is to ask the organization. That's shocking, I know, but ask the organization what their objectives are. So that's the first layer. And the second part of that is that if you're foolish enough to think that's the entire story, you're in deep trouble. So you need to try to triangulate through intermediaries to make sure that you understand all of the organization's objectives, both stated and unstated objectives.
Yeah, I'd like to chime in on that. I think, as you saw, there are many, many, many stakeholders, even within one organization, and each one of them have their own specific agenda and interests. And depending on who you're talking to, the answer might be completely different. So navigating that minefield is part of the art of doing that.
I'll take the other question around, can bunnies and gorillas be equal partners? And, I think we're making an assumption already, a couple assumptions. One, that people are saying, oh, is the gorilla the big guy and the bunny is the little guy. That may not be true. And so that is an assumption that we need to unpack when you start your partnership. What I'll say is one thing that we did in the MAMA partnership is that we created a set of governance very early on that became what was the rules of the game and how to engage as partners. And that is absolutely critical when starting partnerships. And everyone in our partnership has an equal vote and equal voice in all decisions that are being made. And that as well decision we came to in consensus. Other partnerships may decide we don't want to have equal vote, or we just want one person deciding it. I don't think that's how it typically works. For the partnership for us and MAMA, for Johnson & Johnson, it was important that everyone did have an equal voice and equal vote and equal input into how this is, and it really is a true collaboration that way. And so rules of the game, setting those rules of the game and engaging in that way is incredibly crucial to a successful public-private partnership.
I'm Kate Wilson from PATH. I'm not sure that this is voluntary if Carl taps you on the shoulder and says, come on up, come on up. But as a refugee from kind of commercial software and business development, primarily with telcos for about 10 years, which is why Kailik and I have gotten along for the last few years, is that, one, I'd like to say congratulations to all of you. I think you did a fantastic job kind of representing some of the challenges and issues. I thought the one thing that was, I wouldn't say missing because I think everybody touched on it, but we didn't really flesh out, is kind of the full value proposition both ways. And that we are talking about this often as corporate social responsibility or global health is just going to happen. It's like, no, operators have a business model, as Kailik kind of highlighted, and quite frankly, global health has its own model. And we have to be, as you were talking about in terms of this relationship, understanding and finding that bridge, and both groups understanding the other side, and taking it in baby incremental steps, similar to any relationship development. As both gentlemen from RTI kind of touched on, how you think about doing, first, as an old executive once said to me, he's like, why are you trying to get married when you haven't even had coffee yet? We actually have to start with having coffee and kind of understanding what each side needs and wants, and then being able to clearly articulate from both industries' perspectives what we can do. And I thought your slide, Kailik, was actually great, where you said, here's minimal level of engagement, here's medium level engagement, and here's kind of maximum engagement, similar to kind of the Goldilocks analogy of you're trying to find the bed that's just right, right? And you're looking for, first, here's the small bed, like let's figure out a way that we can trust each other and figure out what a team looks like, then find a medium level of engagement, and then go to something where you're really contracting for services. But if you don't give the view of what the long-term picture could look like and what that opportunity is, I think we're missing something, because exactly as a number of people touched on, if you're just talking to them about text messages, it's a highly fragmented market right now. They're going to be completely uninterested. At the same point in time, they need to understand what the long-term picture looks like for health, and that it isn't just about making money, but that they can make money in this, and that the game long-term is providing national-level services, because that's where they're going to need to move in 2 to 3 years.
Thank you. My name is David Ivgi. I'm a creator of a product called CDoc Now, which actually creates an instant network, security network under the brand name of an organization for text messaging, video conferencing, all from the mobile, including directory of 2 million health providers. What I'm contemplating now, and I'm trying to understand, I would like to ask the panel, is assuming that the service will be under the brand name of our future business partners, what kind of support I can get from this type of partnership? Does it mean only the rent for 1 month or something more significant? Number one. And number two, when you establish such relationship with such an organization, what is the level of say about what is the future of that product? How much they can be involved in the decision making of the future of the product once they have helped funded that project?
Okay. Give it a try. I'll give it a try. Okay. I think it depends. Do you like that answer? I think sometimes actually many times when people, when operators contract with organizations, they're not necessarily only looking for the concrete product or service, because we don't know whether that thing is going to work. They're actually contracting for some skills, people, relationships, and people with the vision to kind of take it forward. So I think sometimes we do say, yes, you need to put in like a full business plan with 300 Excel sheets that demonstrate how much revenue will come back, whatever. But the other point of it is also that they're also looking for you to kind of demonstrate the vision to partner for them in the future. And they, both aspects are important.
Mm-hmm. Yeah. Any numbers?
So it depends on who you're talking to, I guess. All right.
All right. I liked very much your comment about the karaoke business. As a fan, as a singer myself, I think I'll move my business to Singapore now.
Yeah, thank you very much. My name is Eugene. I'm from Nigeria. And I'm glad that MTN is participating here. And because MTN has a huge market share as a provider in Nigeria. And when one sees what they are doing in South Africa, and they're literally trying to force their way into partnering with government in health in South Africa, and back in Nigeria, we're literally running after them to partner with us in several aspects of health, then it's really surprising to see the contrast from the same organization. Yes, MTN Nigeria, MTN Foundation Nigeria has done, chemodialysis equipment in several tertiary institutions, and they've done a few corporate social responsibility projects. But for health, should we still go ahead to be looking at corporate social responsibility, a one-off thing where you give a few millions of dollars and turn your back, you don't even know how that money is used? I think that partnering, public-private partnership for health should be a proper investment by the GSM providers, so that they really know, like was said by GSM Alliance, the benefits may not be immediate tangible benefits, but in the long run, like you said, invest heavily and take a leap of faith. They should, and this is not just for MTN Foundation Nigeria, but for every other provider that is willing to partner with the public sector for provision of delivery of healthcare services, particularly using the mHealth models, that return on investment may not necessarily be dollars and cents, pounds and pennies, nairas and kobo, like we have in Nigeria, but taking a leap of faith and looking forward to, if you don't have healthy people, there'll be no person to patronize your products. And in the long run, you'll be, your market will take a dive, a dip, and I think that is not too good. Then when we look at the several other partners that were put up here, are those really partners from the private sector, or are they donor agencies with particular projects and programs that are time bound, and after that they'll withdraw and leave the public sector without a partner? Or are we looking at sustainable partnerships in health programming? I think the panels need to ponder and come up with answers to these questions. Thank you.
Very good question.
Thank you, sir. I think that's one of the reasons I came up here, was from the comments that were just made. My name is Mike Script. I'm the CEO with Garda Technologies, and we are primarily a safety and security company. we do innovations. We invent things. And one of the things we invented was a sensor for object identity. To make a very long story short, we were in a meeting with Project Hope, and both sides had absolutely no idea why we were there. This was several years ago. And I asked them, I said, what's your biggest pain? You know, that's my typical question in the safety and security industry. What's your biggest pain? What's your problem? And what came back was pneumonia. 151 million infants a year, 2 million die. The 151 million is the infection rate. So I reached into my pocket and I said, show me what pneumonia looks like in an infant. And the woman for maternal and health services said, it's tachypnea and a temperature, and tachypnea is rapid breath movement. And as she did this, I put our sensor in her hand, and it counted the breath rate. It counted the movement. And so I said, I think we have a reason to participate here. I think we can count breath rate. And I said, would that be interesting in the field? And you know, obviously the response was unbelievable. So, but then the next problem occurs as a businessman. You have to take a look at how do you eat this elephant? It's 151 million children are infected, 2 million dying. How, as a businessman, do I even look at this? So we came up with this. We said to ourselves, we need sustainability. And what is sustainability? It can't be by donations. I mean, Africa is strewn with hospitals that were donated and empty now because they can't find doctors and nurses. So that's not going to work. So we said to ourselves, I'm an inventor, so I said, what if I assign part of my intellectual property to Project Hope? What if I take my sensor patent and assign the intellectual property to them? Let's start with that. So we do that. Then we say to ourselves, okay, you take the public sector, I'll take the private sector. So we'll work together on the infant respiratory rate sensor. You distribute to the developing world. We'll distribute to the developed world. I'll make a product for the developed world. You make a product for the developing world, which we participate in. They distribute to the developing world. We distribute to the developed part. Okay? We partner in the profitability and share the risks. Exactly right. So we say to ourselves, we can manufacture an infant respiratory rate sensor for roughly $5 to $10. Okay, and that gives a lot of productivity efficacy, that gives diagnostics in the field. In the developed world, we produce a infant care kit that's bought by new moms and dads, and so part of the profitability of us goes to Project Hope. Part of Project Hope profitability comes back to us. We both share research and development together. So now we're looking at true sustainability. I'm not donating anything other than the assignment of intellectual property. And based on that, we've gotten UNICEF, we've gotten other partners to come on board and say, hey, we need this. Whatever the arrangement is, let's get together and do that. Now, there's some huge benefits for American corporations that do that in tax relief benefits, and especially now that it's permanent, you can get 100% tax credit based on the research and development that you do. So if I spend $100 million, I think we're close to $1 million on our research and development. That's 100% write-off for me and the company, okay, as research and development. So there are huge benefits to it on my side and huge benefits on their side. So that became real. That became sustainable. That's what we saw as a way of getting partnerships together. So I mean, if that gives any.
That's a good story. That story just reminds me of a partnership with Merck and I think the World Bank and UNICEF and some other, the WHO, around river blindness, which can be cured basically by taking this pill once a year, which was actually a pill for dogs in the U.S. Metazine, yeah. And so that's been an amazing partnership that's helped eliminate river blindness in a lot of countries through this kind of public-private partnership. So. Dave, yeah, here's Dave. Dave Ross from the. Dave can tell a little bit more about that story.
Yeah, Carl, I was going to tell something about that. I'm Dave Ross. I'm Vice President of the Task Force for Global Health and head of the Public Health Informatics Institute. The Task Force for Global Health manages the Mectazan donation program, which is one of those great partnerships for river blindness. So, one of the things I was going to say about that was that the beauty of it was you have corporate executive sponsorship at Merck. The CEO that started it, Dr. Roy Vagelos, made the commitment on part of the company that is now 25 years long of a commitment that they would treat, they had a drug that is a sort of an inspiration here where the active ingredient is the active ingredient in HeartGuard. So basically the dog owners of the Western world are supporting the treatment of river blindness in in areas of the poorest parts of the world. So he made the commitment that they would continue to give the drug for as long as it needed because it was effective at treating this terrible disease. The partnership really is a partnership among many different groups of governments, the countries affected, the Carter Center, the Task Force, Merck, and many other NGOs. So many different groups come together to help bring about the distribution, manage the supply chain, and work the program. Merck made the commitment to always give, but they get something out of it, obviously. They get a tax deduction from the U.S. government. So the U.S. government is supporting this. So there's a rational business proposition. So at the heart of it all, there is a clear value proposition for all partners. Merck pays us to manage the program and manage the distribution supply chain, but all these other partners work. And the people in country volunteer, but they get something out of it. They don't become blind. So there's a value across the board. It's well understood. And the one other thing I would want to say is that there's, because of the involvement of the Carter Center, they were very thoughtful about invoking President Carter when it came to going to a country to make the president, the leadership of a country, aware that they had this problem. Because it turned out many times the leaders of the countries weren't aware of the health problem that existed. And so President Carter would be involved to go do a state visit and then make the president of that country aware, and then the program would open up. And so I think that's one of the more inspiring public-private partnerships that's happened. Yeah.
You know, just on the heels of that, sorry, I didn't mean to interrupt anybody, but on the heels of that, we've developed 5 projects that have major intellectual property additions to each of it that we share with whoever comes on board, and I'll give you one. It's warehouse management. And one of the things that Project Hope has that they need is a warehouse management. We call it ad hoc management for warehouses. And we're looking for a software partner. We already have a hardware partner. We're looking for a software partner to share the intellectual property. Once it's developed, they sell to the private sector. We sell to the public sector through Project Hope. And we realize as a result of solving that problem, we can do disaster relief much more effectively. So now that intellectual property basis, it goes beyond us. But, you know, it ties in several other industries. I have 4 more projects that are, you know, as tasty for private corporations to get into and develop for. Our problem is advertising. Our problem is networking. That's, you know, that's why my team is here, and we're trying to get the word out as best we can to fill those 5 projects.
I kind of have a question, I guess, for the audience and also for the group or whoever might want to contribute. Is that, so the NGO that I work for, PATH, you know, the name is basically Program for Appropriate Technology in Health. And for the last 30 years, essentially, much of what we've done is look at, you know, what's the continuum between innovation and taking something to scale. And usually there's this time period where there's a kind of valley of death where you need to actually take from what's a good idea, understand truly what the market is, figure out a business model that is appropriate for scaling in the developed world. And we've done that kind of in normal, you know, physical products, vaccine biomonitors, ultra-rice, lots of other things. But we haven't really done that yet, nor has anyone really figured that out, I think, in software. So what is the model that's going to take us from these individual ideas and pilots that all of us have today and actually take us to something at scale that is appealing to operators, that is appealing to others, and looking at some of the innovations that have taken place in global health outside of the software space, advanced market commitments, other instruments such as that, and how do we think about kind of figuring and plugging this hole in this kind of valley of death? Because I don't think we have figured that out, but if we don't, I'm not sure that we're going to move from where we are to where we all want to be.
Thank you to Carl for nudging me forward. I'm Peter Benjamin with Cell Life, based in Cape Town, South Africa. And we're involved in a number of public-private partnerships with J&J, with USAID, with NORAD, CEDA, various others. And it's all about going from a few pilot projects. There are about a dozen organizations in South Africa for the last 4 or 5 years been doing lots of mHealth things and tests of 100 people, 1,000 people, whatever, and starting the very difficult and often confusing and frustrating work of getting everyone together. There's now a core partnership, ourselves, Cell Life, another not-for-profit called Prekelt Foundation, a clinical research organization based at the University in Johannesburg called the Wits Reproductive Health and HIV Institute that's working closely with Vodacom, working with quite a lot of other partners, and starting to get to the scale where we can, in many things talking with the government, though all the frustrations that Jill was talking about are very real. There's Ndebele, one of the South African languages, saying, if you want to go fast, go alone. If you want to go far, go together. And it's exactly, we're going through all those painful learning curves and finding out that to do what we need to do, we actually have to find a way to make profit for the cell phone companies, which wasn't what I thought I was doing 5 years ago. But I realized to actually do the wider ambitions and the social change that motivates me, if we don't do that, we're not serious. We're just playing games again and again and again. So working out with Kailuk and Craig and other people, the real ways to make it a business plan that the cell phone companies can want to take to scale. And that's how we'll be talking about the tens of millions rather than the few hundreds that we're talking about. And one particular idea I'd like to ask the experienced people in the audience. Has anyone in any other country made progress in linking with the telecoms regulator? What I'm thinking about is, in South Africa, the regulator is called the Independent Communications Authority of South Africa, CASA, and they have what's called a universal service obligation, almost like a tax, 0.5% of revenue on the mobile companies. And currently it goes into a big pot of money in the government called the Universal Service Fund and gets fought over, and there are lots of frustrations. It isn't actually used that well, and cases of corruption and the like. We've started to make progress, and Vodacom, the main operators, expressed some interest and talked to others about getting the support from the National Department of Health and the National Department of Communications to urge ICASA to change the regulation so that some of that money can be used directly to subsidize mHealth, so we can get at scale low-cost SMSs, data, free USSD, if you know what that means, and various other technologies that will allow us to just overcome what's currently the biggest hurdle, which is the transport, particularly voice. If we can do IVR at scale, then we can change the country. But currently, we can't beyond a few hundred people in the pilot. So I'd be very interested if anyone else has made progress working through the regulator in moving forward. Thank you.
Yeah, I really want to align with what Peter said, because we really appreciate working with GSM Alliance and Intel, because but for these two organizations, these two private sector organizations, we wouldn't have known that there is a fund lying somewhere with the regulator in Nigeria. Nigeria has the National Communications Commission. That's the regulator for all GSM providers, and unfortunately, they did not, really I say they did not make the Ministry of Health and the parastatals aware that there has been a fund that has been lying there for use by health. And just last month, when we had the launching of the Nigeria's 70 million lives program, we had the opportunity of meeting with GSM Alliance and Intel and for somehow in the discussion, it came up that there's a fund there. So I want to use this forum also to commend that it's really, really important that the private sector network with the public sector, because sometimes you just need someone to make you aware that there's something you should do which you are not doing. Thank you.
Do you have one quick thing?
Very quick, just an idea for Kate on the software business model. What about selling data? You know, that's something that's happening out in the world. I know it's not an easy topic when you're talking about health. Maybe it's something we need to talk about.
Oh, that's a really good point. Actually, there's some interesting work that Switchboard is doing around some of the data they're generating that may not be sold, but it can be used for business purposes for the mobile operators. Okay, so I'm going to close this out. Thank you for a great panel session, and thank you for all the participants in the fishbowl. I just wanted to share, I've been writing down some kind of key points or lessons, so I'll just go through them really quickly. Ask the organization what their goals are and then triangulate. PPPs are hard, but we must do them in order to reach our goals. If you want to go fast, go alone. If you want to go far, go together. Take a leap of faith and follow the long and winding road. I feel like this is a poem or something. Stay true to your mission. Health sector is focused on innovation, not scale. This is a problem. Acknowledge differences between the different entities in terms of their core product, their scale, their definition of sustainability, and find a joint value proposition. Don't just see mobile network operators as network operators. I think that was a really important point from Khalik. That was a great slide. This leaves a lot of opportunity on the table. Package health as a sector in the larger for a value proposition to governments. Think about a stakeholder map. So what is the unique expertise and experience? Everyone has a different motivation for being at the table, but unite behind a shared goal. Cultural differences are hard and need to be managed. The whole is greater than the sum of the parts. Hold on, almost done. Find a value proposition that goes both ways. Don't get married before you have coffee. Find a rational business proposition, and one word I leave you all with, karaoke. Thank you all.